president of the Australian and New Zealand College of Anaesthetists, so I've got to always be ready to explain how anaesthetists look after you when you're having surgery.
We are always ready to continue to learn and update our skills so that we are always ready to give the best possible care to our patients.
I'm always ready for a clinical challenge.
I'm always ready to have a conversation about ways that we can minimise the environmental impact of our practice in anaesthesia.
I'm always ready to extend kindness, compassion and empathy to my patients.
Anaesthetists are always ready in multiple ways. We deal with all sorts of crises and are always ready for the unexpected.
As anaesthetists, we're always ready to take care of you when you're at your most vulnerable.
We are always ready for the routine aspects of anaesthesia, caring for you before, during and after your surgery.
I'm always ready to ensure that my patients are comfortable after their operations.
Anaesthetists always ready is a very appropriate theme for 2020. Anaesthesiologists have amazing skills inside and outside the operating room.
I've seen many examples of anaesthetists demonstrating this always ready attitude in my workplace, whether it's managing complex, unstable patients in the operating theatre, rushing to the emergency department to help in the resuscitation of multi-traumas, or quickly heading to the birth suite to help place epidurals and relieve the pain of women in childbirth.
I'm always ready to acknowledge that not everybody has the same access to that care and that we need to do all we can to address that.
I'm ready to look after you while you're asleep for your surgery and make sure that everything is safe.
I'm ready to breathe for you when you stop breathing.
I'm ready to replace any blood that you may have lost.
I'm ready to stop your heart from going too fast, too slow, or even if it stops beating at all.
I'm ready to keep you comfortable when you're in pain.
I'm ready to make it possible to deliver your baby when your baby needs to be delivered now.
I'm ready at 8 a.m. on a Monday or at 2 a.m. on a Saturday.
We are always ready.
We're always ready to be more sustainable at home and at work.
Anaesthesiologists, we are always ready for change.
I'm an anaesthetist and an inventor, and always ready to solve problems.
We use simulation as a tool to develop guidelines, educate our staff and remain always ready.
I'm sitting here in my office, getting through the mountain of emails that directors get, dealing with the usual run-of-the-mill stuff, but I'm also in scrubs, as you can see, and I'm ready at a moment's notice.
We need to have the ability to anticipate and plan for any eventual scenario, outcome, events or complication. And that is why we are always ready.
Always have to be ready to go into the emergency theatre and do something that needs to be done.
What makes anaesthetists always ready?
It's our training. 5 years of world-class critical care training in the Australian New Zealand College of Anaesthetists that makes us medical experts who are always ready, no matter what comes through the hospital doors, whether it's one patient or a busload.
Or even more.
Anaesthetic training prepares you to be always ready and to be creative with the very limited equipment and resources you have at hand to be prepared for whatever comes through the operating theatre door.
The challenges, or more specifically, how we react to those challenges, are an integral part of the DNA of anaesthetists. We prepare, we adapt, we deliver, and most of all, we are always ready.
I'm always ready because I'm lucky enough to have trained in anaesthesia in Australia as part of the Australian New Zealand College of Anaesthetists Anaesthesia Training Scheme.
When I was asked to lead our department response to COVID-19, I was ready.
You're always ready to jump to a challenge.
I'm always ready, and keeping a big bag means that I always have exercise with me.
Ready to come out and just relax and reflect on what we've achieved as a specialty.
I'm always ready to listen, and I'm always ready to learn. Happy National Anaesthesia Day, everyone.